section, I'm going to observe for general posture imbalance, deformities, asymmetry, atrophy, or hypertrophy. So taking a look here, you know, at the neck, the back, everything there, and then at the front as well, just making sure that the skin folds all look even. So for the neck, I'm going to, I should make sure I'm doing the same thing as it's up here. I'm going to inspect for symmetry of the skin folds and muscles, and then I'm going to, which I just did, then I'm going to palpate the cervical spine and the paravertebral musculature, trapezius, sternocleidomastoids, sternocleidomastoid muscles. Palpating the cervical spine here, the paravertebral musculature. And then that trapezius, remember, is a giant muscle, so it kind of comes all the way. It's like a big diamond here. So making sure that we are palpating this whole area. And then the sternocleidomastoid muscles, which a lot of us will have already done when we are doing the lymphadenopathy exam. So next I'm going to assess the active range of motion. So this is the same thing as last week where you guys are going to be doing a lot of coaching to your patient. So I'm going to have you flex your neck. So I'm going to have you put your chin to your chest. Should be about 45 degrees. And then we're going to have you look up for me. Good. That's judging extension. And then we're going to do lateral flexion. I'm going to have you put your ear to your shoulder. Ear to your shoulder. Good. And then say no. Shake your head side to side. Good. Perfect. And then you're going to have to do this with them as well. So that's what, I mean, most of the time that's what you're going to end up doing. So you guys are both going to be crazy going like this to each other. So next I'm going to do the thoracic and lumbar spine. I think we should inspect first. Let's see. So maybe we can switch that on there too. But I think we should be inspecting first. So I'm going to inspect for spinal curvature during slow forward flexion. I'm going to have you hop down, Lindsay, and then turn around for me. Oh, sorry, I don't want you to hit your head, so maybe let's turn this way. Okay. And then I'm just going to have you bend down really slowly and touch your toes. Just taking a look here at the curvature of the spine during slow forward flexion. Okay, you can come back up. All right, and then we're going to do the same thing. Palpate the spinous processes and paravertebral muscles for tenderness or muscle spasm. So I'm going to start here at C7, palpating the center. And so a lot of times I'll just kind of like shimmy your hands down so that you're kind of getting a little bit more of a feel of what's going on. And then also you're going to be doing the paravertebral musculature. Sorry, I didn't mean to pull your hair. Good. Any tenderness? Okay. Next, I'm going to assess active range of motion of the thoracic and lumbar spine. Okay, so we just did flexion forward, but I'm going to have you bend forward and touch your toes again. So flexion, good. That should be about 75 degrees. And then I'm going to have you kind of bend backwards like this. Good. Okay, extension. And then I'm going to have you do lateral flexion. And so what we're going to do, you're going to take your right hand and you're just going to run it down the side of your leg. Good. Same thing on the other side. Try to touch the side of your knee. Good. And then for rotation, I always tell my patients, take your right hand, put it in your back left pocket. So right hand, and then you're just going to turn. What you're going to do, well, what I'm going to do while they're doing that, we're going to stabilize the pelvis, make sure that nothing's moving. Okay, go ahead. Good. Same thing, other side. Good. All right, now we're on to the shoulders. I'm going to have you can hop back up here. I'm going to inspect the clavicles, scapulae, and area muscles for symmetry, swelling, atrophy, or deformity. So I'm just taking a look here. Good. Then I'm going to palpate the sternoclavicular joints. So when you guys are doing this, I want you to actually, be very dramatic when you are palpating the areas of the shoulder so that we know that you're palpating the right place. Because there's a lot of anatomy here, so make sure you review that before you go. So we're going to be looking at We're going to be palpating the sternoclavicular joints, the clavicles, the AC joints, which are more up on top here, the greater tuberosity of the humerus, the bicipital groove. What's next here? Where did I go? Bicipital groove, and then the coracoid process, which is kind of right here. Yeah, and then the scapulae. You're just going to feel along like the spine of the scapula, and then I also do kind of like down along the bottom. You're going to feel along the spine here, and then I do also kind of the inferior part of the scapula. You're going to do that on both sides. Good. And area muscles for tenderness. Then I'm going to assess the active range of motion of the shoulder, or at the shoulders. So I'll have you hop down, it's just gonna be easier. We're gonna do forward flexion, so raise your arms above your head. Good. Hyperextension, arms behind your back. Good. I'm gonna have you do abduction, raise your arms laterally above your head like this, and then you're gonna crisscross in front of your body. Good. Internal rotation of the shoulder joints is arms behind your back, and then put your arms above your head for external rotation. Great. Now I'm going to assess the rotator cuff. You can hop back up here. Let me turn my page. All right, so I'm going to be assessing the rotator cuff strength. We're going to start with the supraspinatus, and so this is going to be the empty can test. So the patient's arm is going to be up like this, right? You're going to go here, 30 degrees forward, thumbs down. And then they're going to, yep, perfect. And then you're going to press down and they're going to press up. So I'm just going to have you resist my when I'm pushing your hands. Good. And if that hurts, that means that there might be an injury there in that supraspinatus. Next is going to be the infraspinatus. So we're going to do that with resisted external rotation. So I'm going to have you put your elbows like this, and then you're going to push out against me. Push, push, push. Good. Then we're going to test the teres minor with resisted internal rotation. So keep your elbows at your side at 90 degrees. Push my hands together. Good. The subscapularis. I'm kidding. Yeah, I'm kidding. And then for the subscapularis, so tell me, pause. Okay. Next, I'm going to assess the subscapularis with the lift-off or the belly press test. Since my patient has full mobility in her shoulder joints, we're going to do the lift-off. I'm going to have you put your arm at the lower part of your back here, and then just lift your hand off of your back. Good job. And then I'm going to have you do the other arm as well. Excellent. And then for demonstration's sake, I will have you do the belly press test as well if your mobility is limited. So I'll have you put your palm over your belly button and then push it. Good. And then same thing, other side. Push it. Good. Okay. Next, I'm going to perform the NEAR test. And so the NEAR test, you put your hand here, you're going to stabilize the shoulder joint. And I remember this by NEAR is near the ear. So you're going to, now you're going to do passive range of motion. So I always have the patient relax. Do your very best to give me the full dead weight of your arm. And then I lift all the way up just like this. That is the NEAR test. Same thing over here. Good. You had a crack. Okay, so then the Hawkins test is going to be next. So the Hawkins test is, let's see here. Oh my gosh, I didn't do any. That's this one, right? Yeah. Okay, so you're gonna come, so you're gonna come out like just like so. Have the patient put their arm just like this. You're going to stabilize again in at the shoulder joint, and then you're gonna kind of rotate down just like that. Same thing, other side. Good. Stabilize the shoulder joint. Good. Then we're going to perform the apprehension test for shoulder dislocation. Did you guys watch that video? No? Okay, so you have to make the face then. So this is really great. So you can do this either, you can do standing, sitting. You can also have the patient laying down as well. So the apprehension test, you're going to have the patient put their arm out just like this. And then what's going to happen is you come back here, you're going to stabilize the shoulder joint, and then you're going to kind of push just back like that. And then Lindsay has an apprehensive expression. That's a positive apprehension test. And so then if you do have a positive apprehension test, so that's like for shoulder dislocation. So if the shoulder is dislocated, I'd be so surprised if your patient actually let you do this. Most of the time they're not going to let you do that. But for the sake of learning, so the apprehension test, if it's positive, then you have to do the, what you call it, the reduction test or something. And that's where you literally, so you're going to go just like, so you start here, apprehension test is positive, then you're just going to push down on this and just kind of bring it back. And it's just going to go right back in. And we're going to do that on both sides. Well,
for some, for some glenohumeral instability. Okay. So if they have previous dislocations, or if they have some glenoid disruption, that labrum's not intact, that's going to cause some discomfort because they don't have the stability in that glenoid.
Great. So now we're going to move on to the elbows. I'm going to inspect the elbows for symmetry, swelling, atrophy, deformity, and carrying angle, which is normally 5 to 15 degrees. I'm inspecting, and then carrying angle is like from the midline of the body, you get to the elbow, and then it should be about 5 to 15 degrees in this, from the elbow down here. So that's 5 to 15 degrees. Next, I'm going to palpate for tenderness with the elbows fixed to 90 degrees. So I'm just going to have you, yep, perfect. I'm going to palpate the extensor surface of the ulna. I'm going to palpate the olecranon. On both sides. And then I'm going to palpate the medial epicondyle here. Here, and then the lateral epicondyle. Then I'm going to assess the active range of motion. So this one's going to be very easy. So I'm just going to have you flex up just like this, and we're going to extend out. So that's flexion and extension at the elbow. And then we're going to test pronation and supination with the elbow flexed at 90 degrees. So I'm going to have you go just like this, and we're going to go this way, supination, pronation. Let's see. Next, I'm going to assess muscle strength of the elbow against resistance. And so we're going to start with flexion. So I'm just going to have you push up, good, and then push down, that's extension. And then we're going to assess medial joint stability. So this is kind of the same thing, same kind of concept as the valgus stress test that we did on the knee. So we're start grabbing here, and then you're going to apply pressure to the lateral aspect of the elbow here. And I'm just going to kind of relax the elbow joint just a little bit, and then you kind of apply a little bit of pressure. Okay. Next, we're on the hands and wrists. I'm going to inspect for symmetry, swelling, atrophy, or deformity, including the thenar and the hypothenar eminence. Show me your hands. Okay, turn over. Good. Okay, and then I'm going to palpate the joints for nodules, swelling, or tenderness. So we're starting with the DIP joint, which is going to be distal. So we're going to start here, here. Well, that's just the IP joint. Here we go. And then the PIP joints. Good. And then the MCP joints. And then I'm going to palpate the radiocarpal joint. So the radius, right, is on the side of the thumb, but then that has the most surface area that attaches to your carpals, or it interacts with your carpals. So you're going to palpate all along this wrist joint.
Whoops.
Okay. And then I'm going to palpate the anatomical snuff box for suspected scaphoid fracture. So also, I see on here it says navicular and scaphoid. I would just say they're kind of synonyms, right? Kind of, but navicular, you also have the navicular, you can have a navicular fracture in your foot as well. So in the spirit of clear communication and clear documentation, I personally would stick with the scaphoid fracture when you're like documenting and communicating with your staff. That's just a side note. So I'm gonna have the patient give me kind of like a thumbs up so I can identify their anatomical snuff box, and then I'm going to palpate just right in that joint. And then if there's any tenderness, is there any tenderness here? Nope. Okay. If there is tenderness, then I suspect a scaphoid fracture. Next, I'm going to perform the Tunnel's test for carpal tunnel syndrome. So I'm going to have you turn your hands over. And so this is, we're going to go right here in between the thenar and the hypothenar eminence. So you have your flexor retinaculum right here. And so what you're really trying to do is tap on an irritated median nerve, okay? So I'm going to have the patient kind of like relax their wrist out, and then you just give them a nice, like a hard tap, okay? And if that gives them pain, then that's a positive Tunnel's sign. You're going to do that on both sides. Any pain? Nope. Okay, next I'm going to perform the Phelan's test for carpal tunnel syndrome. Okay, Lindsay, I'm going to have you're going to bend your wrists down like this, and then I'm going to wait for 30 to 60 seconds, and if you get any numbness or tingling, that's a positive Phelan's test. We're waiting 30 to 60 seconds. And then for the spirit of the exam, I'm okay if we are not just sitting in there twiddling our thumbs for 30 to 60 seconds. But you do have to verbalize for 30 to 60 seconds, okay? Let's see where we're at here. Okay, good job, Lindsay. Next, I'm going to assess the active range of motion. So we're going to do MCP flexion. I'm going to have you make fists on both sides. Good. And then MCP extension. Open your hands out wide. Good. And then we're going to test thumb opposition. So I'm going to have you touch the tips of your thumb to each fingertip. Good. And then the base of the pinky all the way down here. Good. Next, I'm going to test wrist flexion, which she's kind of already doing. Wrist extension, good. And then we're going to do radial deviation. So you're going to put your hands out just like this. We're going to go, wait, is it like that? No. We can.
You could do either.
Yeah, okay.
Position,
So yeah, I would say just do, however's comfortable for the patient, because this is kind of uncomfortable for me. So palms to the floor, and then you're going to do turn your wrists in, turn your wrists out for radial and ulnar deviation. Next, I'm going to assess the muscle strength against resistance. So I'm going to do the grip strength. I'm going to use 2 fingers on both of my hands. I'm going to have the patient grasp and squeeze, 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 squeeze. Good. Just kidding. Then next, I'm going to do finger abduction. So I'm going to have you splay your fingers out. Oh wait, this is against resistance, right? Okay. So for this one, you're going to splay your fingers out. Don't let me close them. Okay. So we're going to go just like this, kind of testing each one. Good. And then finger adduction. Yep, just bring them in. Perfect. And then thumb adduction. So I'm going to have you put your thumb to the base of your pinky, and then don't let me pull it off your hand. Good. All right, next we're going to test wrist flexion and wrist extension. So put your hands out just like this, and then push up against me. Good. And then push down against me. Good. Yo, that's it.
Is it?